people of Machakos for 3 years. Then they said, we can now proceed you in your professional development, train you, but still work for us because we have paid for you your fees for a short time. And then after that, whatever you do, wherever you become a consultant, whatever, you can still continue being a public servant if you want. Yeah? But you have served your time. But you have looked at the bigger picture. In future, we will need a gynecologist in Isiolo, which did not have a gynecologist. So, and that was before devolution. So even me, I can come and say, Isiolo had no gynecologist. Before devolution, by the time I left Isiolo District Hospital, it was an internship center, 4 consultants, 10 doctors. Also say that if I am to run the same, but the system as it is now, even as the counties claim to employ people, does not allow professional development and specialization and betterment of health of this country. It can't. Now that the governor is gone, and I'll give you a good example. Kenyatta National Hospital is employing medical officers with contracts which say that you cannot go to school. Professional development of medicine in whatever area you are, you must have continuous development. You cannot stagnate there forever. And I'll tell you the problem we are having now. I'll use a simple, the basic doctor. The basic doctors have been employed. They work for their 3-4 years. Then when they want to go to school for specialization, they are told, by the way, that position that we have, we do not have someone to replace you. So they are stuck. You cannot employ someone because county government is saying there is a payroll. If you had a health service commission, this doctor, medical officer, is released to the health service commission. The health service commission provides a health worker for that position. This guy continues for training. The service continues to the people. Yeah? And when he finishes, we now look, Mandera kuna neurosurgery went, and you post him there. Mandera will never sponsor a neurosurgery. It's too expensive for them. Yeah. So I think with that, yeah.
Thank you very much, Simon. Again, I appreciate your passion in what you're saying. And that's why this conversation is very important, so that we can listen carefully and avoid making political statements that are convenient when we actually have a challenge that we haven't addressed.
Yes.
It is very clear that there is an issue, and we need to figure out how that issue can be dealt with going forward. Listening to you, Simon, I'm just wondering, it is true, and by the way, what you have said is correct, because it came to IBEC, and many counties were saying, we have doctors who want to go at the county's expense to go and continue their education. So we have to do 2 things. We have to pay for this doctor to go learn, and then we have to hire another person to do what he was doing. So the counties were asking, this is too much. We cannot have it. We cannot carry, you know. So I agree with you that there is a challenge. Counties saying they do not have the resources to do that, to give you a bursary or a grant, a scholarship to go learn, and then hire somebody else. Is it possible for us to figure out how we can continue career progression, we can continue to train more personnel, more doctors, more neurosurgeons, and all the other health professionals in the context of devolution? Or we must completely get out of it? I think we need to find a middle ground, a balance between those two. If we do, we will not only satisfy our health workers, but also keep devolution doing what they are doing. And Daktari, I am sure you agree that the devolution has done some things right.
Yes.
You agree with that?
Totally.
Yeah? So we just need to correct what they have not been able to do. And I agree with you 100%. That issue came to IBEC, where counties were saying, we don't have the money first to give a scholarship. And even if we did, it means we have to hire somebody else to do, because, going to train for a postgrad is not going to take months. It's going to take minimum 3-4 years. So for those 4 years, somebody must deliver the service. So while I agree with you that a health commission who has a bigger deployment of doctors would easily replace that doctor from somewhere else, but we need to contextualize it around what we actually have now in our counties. And I think there is a possibility of having a conversation that will give us that balance.
And Dr. David said something that I really need to correct. There is no problem with a doctor working in Nairobi, wanting to work in Nairobi. Why? The terms and conditions, availability of social things are there. So it is upon the government to ensure that out there, you create an environment that allows me to have my children with high quality schools and things like that. Therefore, it's not a problem for people to move to a place where they want a betterment of their family. And on that note, currently as we speak, medical health care workers working for national government have better terms than we in the counties. People of my age, I've worked in
contemporaries.
My contemporaries, I have better terms of service at national and Nairobi than in county. Then why should you then expect me to be the sacrificial lamb? I'll give you one example. When they devolved, mortgage was not devolved. Mortgage was left for the national government employees. There is no county which is facility, despite them being taught by national government before devolution how to. We don't have. Then you expect your colleague has a house, you are there working in the county, your pay is less, your benefits are less, you have less access to social amenities. So for government, DP, it is the role of government to equalize health workers. And when I worked in Asal, the day I was posted to Isiolo, my house allowance was reduced by 30,000. But we were posted with someone in another area whose allowance is dead. Then people complain, why do people want to come? Because of these disparities which have not been addressed. So you're treating people differently just because they work in different countries. Yet we are